Fine. My name is Fides Peter Matem. I'm here to revise with you a Form 2 class, subject biology. And today we are going to focus on the topic safety in our environment. This topic is safety in our environment. We are going to base on the subtopic first aid. And specifically, I will deal with the meaning of first aid and its importance. First aid kit, the components of the first aid kit and their uses. And also, I will discuss with you how to render first aid to the victims of insect bite, snake bite, and bleeding. Okay, students, do you know why the National Examination Council has decided we teachers to revise on this topic of safety in our environment? This is because it has shown that when it comes to the national assessment, most students fail to perform well in this topic. That's why we are revising with you. Now, I hope that at the end of this topic, when of course, we will have a series of lessons concerning this topic. At the end of this series, under this topic, I hope you will be able to respond to questions correctly when it comes to national examination assessments. Now, my today's presentation is guided by several questions. I've prepared some questions. When you answer this question, of course, you'll be able to answer the questions from this subtopic of today, of first aid. Look at these questions. Why the school should have a first aid kit? Why the school should have a first aid kit? Why it is important to give first aid to a victim of accident before taken to the hospital? How you will render first aid to your fellow student who has been bitten by a wasp? How you will render first aid to your fellow student who has been bitten by a snake? Also, while alcohol should not be given to a victim of a snake bite, how you will render first aid to your fellow student who has been injured and also bleeding on his legs? Why it is important to wear gloves when providing first aid to a victim of bleeding? Now, through these questions, all these questions will be covered in my presentation. And my presentation specifically will be guided by this question. There is this question number 8 here, which it looks. This question number 8, it shows a scenario of students who got there is an event which happens to them. Now, when I'll be teaching you or I'll be discussing with you in this presentation, I'll be using this question to explain more about how to render first aid to these victims. You can see the question. A group of students entered the bush near our home, and 5 minutes after their arrival, Some of them were running out of the bush shouting for wasp bite, Anna laid down crying for snake bite, and Juma had bleeding on his leg. As a Form 2 student, suggested the first aid procedures that must be given to each of the accident victim. Now, this question is a scenario, but I will present my revision by just citing this question. So at the end, you will be able to answer all other questions together with this one. Now, let us come into my focus of today's lesson, which is how to render first aid to the victims of insect bite, snake bite, and bleeding. Now, before we can discuss how to render first aid to various accident victims, I think you are listening to me. Now, can you tell me what is first aid? Yeah, that one is simple. I can see that you are answering it. That first aid is an immediate assistance given to an injured person before this person is taken to the hospital. Or we can say is a help given to an injured person before taken to the hospital. So this immediate assistance or immediate help given to the injured person just immediately around the area of accident at the exact time. Don't wait because more harm can occur or can happen. Now, is there any importance of rendering first aid to these victims, maybe of accidents, maybe the person who has got a car accident? Yes, I think there is an importance. Now, can you mention some of the importance of rendering first aid to these victims? This is simple. You studied this one in Form 1, so just a revision for you. One of the importance is that it relieves pain. When someone got an accident, of course, there must be some pain. So it tries to relieve pain. Another important you can mention is it saves life. Another importance, you can mention many. Another one is that it gives hope to the victim, or it gives encouragement to the victim. You can mention other important of first aid. Yes. Another important is that it minimizes the intensity of injury, tries to minimize the effect of injury. It minimizes or it reduces the effect of injury to the victim. Is there any other importance? Yes, of course there is many importance, but let me mention the last one, that is it removes fear of death. You know, when someone got an injury, sometimes can be a fatal injury. This injury makes the person to develop worry and fear. So when you give first aid, at least he got hope that there is life. So it just removes the fear of death. And also you can add the other one, that it just prevents shock. Thank you. These are some of the importance of giving first aid to an injured person. Now, before giving first aid, you must have a first aid kit. Sometimes you can use the instruments which are around the accident area. But if you are supposed to use the instruments, they are kept in a box which we call it first aid kit. Let me show you what is a first aid kit. For those who are not familiar with what is a first aid kit, let me show you what is it. This is the first aid kit. What is the function of this one? Is to store or to keep instruments which are used to render first aid for various accident victims. Let us see what is inside. You can see various components of the first aid kit. I shall discuss with you some of them so that you can know how we can use them. What is the first aid kit? As you have seen it, as I've shown it to you. Is a small box which is used to keep the instruments or the facilities which are used to render first aid to various victims of accident. Now let us see the components. Our first aid kit has many components. Here I'm just going to mention the few because I hope this is just a revision. I'm just trying to show you, especially for those who are not familiar with this box. There is some components which are necessary to be kept in this box. For example, here, there is this is a methylated spirit. Methylated spirit can be used instead of GV or gelatine violet, which is used to sterilize wounds. In your first aid box also, there is this is a razor blade used to cut bandages. The sterile gauze can be used to cover the wounds. There is this cotton wool to clean the wounds, soap to wash wounds, equipment, and the hands. Ointment which can be applied on burns. A pair of scissors can be used to cut materials for first aid such as the gauze and cotton wool. There is this adhesive bandage. This is the adhesive plaster, of course, used to apply on minor wounds. It adheres to the wound, applies to minor wounds. The gloves, you wear the gloves when rendering first aid to victims who might contaminate you with the body fluids such as blood, vomit, or diarrhea. You have to wear the gloves. Dettol also can be used to sterilize wounds. Those are the few components to mention for you to be aware and familiar with the first aid kit. Sterile gauze to cover wounds. Cotton wool to wash wounds and dry wounds. Protective gloves to cover the hands. Safety pins to secure bandages. Also plasters to apply on small wounds, to cover small wounds. And so on. So you can refer to the first aid kit as I have shown you. There is a lot of components. Now, what you're supposed to know also important about the first aid kit is that first aid kit must be placed in an area where everybody can access it or can see it, so that in case of an emergency, they can take this first aid kit and use the equipment inside to render first aid. Now, another thing, my dear students, before doing first aid to any victim, what are you supposed to do? There is important precautions and safety measures which you have to follow or to know before you render first aid. And you have to identify the kind of first aid which you are supposed to give so that you take the precautions. Now, here is one of the precautions. The most important precaution is put on a pair of gloves so that you can handle things like body fluids like vomit, blood, or diarrhea, and so on. Don't use the bare hands. And also you can use eye goggles to protect your eyes, and other isolation equipment such as body isolation equipment such as the coat. You can wear it. You cover your hands and so on. Now let me go direct now to my focus, exactly what I'm supposed to revise with you right now. My dear students, now let us come to our focus of how to render first aid to victims of various accidents. Specifically, of course, I want you first to know that these various accidents, there is common accidents which occur at our home and at school. For example, there is accidents of snake bites, insect bite, bleeding, poisoning, nose bleeding. There can be accidents like muscle cramp, these are the few to mention. You can add more, my dear students. Now, today I will focus on how to render first aid on the victims of snake bite, insect bite, and bleeding. Now, I have prepared a question which, when you tackle this question, of course, you will know the procedures. This is my model question. One day, a group of students entered the bush near our home, and 5 minutes after their arrival, some of them were running out of the bush shouting for wasp bite. Anna laid down crying for snake bite, and Juma had bleeding on his leg. As a Form 2 student, suggested the first aid procedures that might be given to each of the victims of accident. You know, this kind of a question, if you come across it in the exam, most of the students find it, maybe it is very difficult, but actually it is not difficult. Let us go together now, try to answer it. If you look at it very closely, you will see that some of these students were running out of the bush shouting wasp bite. So here there is the issue of wasp bite. Anna was lying down crying for snake bite. Here there is snake bite. And also Juma had bleeding on his leg. So let's begin with this one, snake bite. Anna laid down crying for snake bite. How can we help Anna? So procedures for giving first aid for a snake bite individual. Now what is important here first, you have to know that when somebody is bitten by a snake, they tend to be terrified. They get fear. Now what you're supposed to do, the first procedure, calm and reassure the victim and lay him or her down or sit down. Calm down. Why do we calm and reassure the victim? What does it mean when you say to calm down and to reassure? This is to give hope. There now we can see the importance of first aid, to give hope. You give hope to the victim because right now this victim has got a fear of death. You have to reassure, give hope and encouragement that everything just be okay. So that is number one. My dear students, what do you think will be the second procedure? Okay, some of you are mentioning wrongly, others are mentioning correctly. Okay, let me help you. The second procedure, as it is written there, support and immobilize the bitten area. What is the aim of support and immobilizing the bitten area? This is to ensure that the bitten area does not get any movement, so that to secure the poison not to go far to the heart or not to go into the blood circulation. So that's why you don't move the area. You mobilize the part to ensure no poison moves. To the circulatory system. Another procedure here, tie a wide elastic bandage or clean cloth around the limb above the bitten area. Why should you tie the parts? We tie the parts, you know the reason. This is to prevent blood not to go into the circulatory system rapidly or into the heart. So therefore, at least you restrict the venom not to move into the blood system. To the blood system. And my dear students, you can mention the other step. Wash the wound with soap and water. Why do we wash the wound with soap and water? Soap and water will neutralize the acid and also will try to remove the venom which is around the wound. My dear students, there is a last stage. Of course, you know it. If there is some complications occur at that stage number 4, take the victim immediately to the health hospital for further medical checkup. Now, if you look at those procedures, why can't we begin with support and immobilize the bitten area? Or why can't you start with washing the wound with soap or water? These ones are technical and they are very important arranged according to their importance, that you have first to calm and reassure the victim, then mobilize the part, you apply the bandage to prevent further moving of the poison. You wash the wound, and finally, if the victim will not recover, just rush the victim to the hospital. There is a question also here which you must ask yourself. Briefly explain why it is not advised to give alcohol to a victim of a snake bite. Can you think about it? Can you give the answers? Yes, we have to. The answer is that alcohol is a stimulant. It will raise the heartbeat. As a result, the venom will circulate fast in the blood. So you are not supposed to give alcohol to a victim of snake bite. Not only alcohol, also even coffee. Those are the stimulants. They stimulate fast movement of the blood into the body, to the heart. As a result, can bring more problem to the victim. We have tried to answer the first part of our question. The second part of our question here, there is those group of students were running out of the bush shouting for wasp bite. So procedures for giving first aid for a wasp, for insect bite. Now, insects, they bite. Of course, insects like bees, like wasps, they bite. Now, what procedures will you take to help the victim who has been bitten by the wasp? Here you have to know that when they bite, they leave the sting in your skin. Insect bite. And the sting. Wasp and the bees, they have a sting. So what should you do is that you have to remove the sting first. That is the first procedure. At this stage, you have to remove it because when it is left in the skin, will continue releasing some venom. And how do we remove it? We remove the sting using a blunt object, like a plastic card. Not use a pin, because pin will punch the sting, and that sting will continue releasing venom into the blood system, causing swelling and pain. So you have to use a plastic card. Or a blunt object. To remove the sting. My students, you can see the procedure number 2, which is wash the area with a weak solution of sodium carbonate or baking powder. How do we make this solution? You can take 2 teaspoonfuls of salt, mix it with a half a liter of water. You will get that solution of sodium carbonate. Or you can use baking powder, which is commonly used at our home. That one will have a neutralization tendency and will remove the poison or the acid, because the venom is acidic in nature. And also another, apply antihistamine cream to the wound. This antihistamine cream can be hydrocortisone cream, calamine lotion, or the baking powder. You can use it also to remove the allergic reactions, because antihistamine cream has a tendency of removing inflammation and allergic reactions. So that's number 3. Removes allergy. The other procedure is that cover the wound with the cold compress. Cold compress here, it means you take the ice, you can wrap it in a piece of clean cloth and apply it in the wound to remove swelling. And guess what? What will be the last stage? If the inflammation did not stop, or swelling did not stop, what will you do? My dear students, you will just rush the victim to the hospital for further treatment. That is the second part of our question. Now let us look at the last part of our question. Here there is Juma had bleeding in his legs. How can we help Juma? From our question where we saw Juma was bleeding the leg when he came from the bush, now let us see how to render first aid to the victim of bleeding. Before you can give first aid to this kind of a victim, there is safety measures which you have to take, as I told you. Wear protective gloves so that to make yourself free from germs or contamination. And also you have to know that the aim of giving first aid to a victim of bleeding, the aim is to restrict blood not to come out from the wound. Now, what you have to do is to make sure that blood is not coming out from the wound. We do this by two ways. Either we apply direct pressure, or we elevate the wound. Direct pressure is where you apply a piece of cloth or you compress the wound. You can use your fingers, which are clean, or you can use a piece of cloth directly to the wound. That is called direct pressure, to make sure that the blood vessels become flat and to prevent blood not to come more to the area. And the second method is, if this one will not work, you will use indirect pressure, whereby you will just go to the main arteries which are supplying blood to the wound. So indirectly you will tie those blood vessels. If it is the arm, you can tie the brachial artery. If it is the leg, you can tie the femoral artery. These are the main arteries supplying blood to those areas. Now, if this fails, this one can be used to stop blood from coming out. And you can use the issue of elevation if minor wounds has occurred. Can stop bleeding immediately. Juma was bleeding. Now, how can we help him? Now, these are the procedures. First, what you have to do is to calm down and reassure the victim. The same as I have told you, the case of insect bite, that you calm down and reassure the victim because they are frightened. To remove fear, rise in the injured part or elevate it. If it's the arm or if it is the leg, you have to elevate so that to prevent blood going to the wound fast. Another procedure, apply pressure directly to the wound. for 5 or 15 minutes using hand if possible. Now, I want to tell you that the procedures of rendering first aid to the victim of bleeding depends on the intensity of the injury. If the injury is severe, you have to apply direct pressure, that is to press the area with a piece of cloth. Or if the injury is small, you have to apply direct pressure, where you press the injury with a piece of cloth. But if it is severe, you will use indirect pressure, whereby you are going to apply pressure to the arteries which are supplying blood to the wound. Now, what you are supposed to do here, for this case, as you have seen there, apply pressure direct to the wound 5 to 15 minutes. This means that this wound might be it is a minor wound. Remove clothing to expose the wound and cover it with sterile gauze or piece of clean cloth. What does it mean? This means that you have to remove the clothing so that to check if blood has stopped. And if blood has stopped, you have to just cover with a sterile gauze to prevent infection. But if severe bleeding continues, in case of severe bleeding, use indirect pressure. You'll just go to the main arteries of if it is the arm, you tie the brachial artery. If it is the leg, you tie the femoral artery. These are the main arteries. So you will try to restrict blood coming to the wound and encourage clotting. And number 6 there, that is the procedure. If the bleeding cannot be controlled by pressure or elevation, now you have to use a wide piece of cloth. Cover the wound, the area just around the wound, to prevent blood not to gush out, come out in a speed. You see, that is another procedure. And this covering, make sure that you will untie it or you will loosen it after every 1 hour. Why? This is because if you continue tying, you will prevent blood circulation in the body. You will deny the body with enough oxygen, will bring more problems. And also you have to loosen this wrap. This is because also to check if blood has stopped. But finally, our last procedure is that if it happens that blood is still coming out, you have to rush the victim to the hospital. Transport the casualty to the hospital as quickly as possible. My dear students, up to now, you will be in a position that you have responded to the question correctly. Let's now summarize our lesson by watching a short video clip trying to show how to render first aid to the victim of snake bite. Okay, students, let us watch now a short video clip trying to summarize what I have been teaching you about how to render first aid to a victim of snake bite. That is a pair of gloves for protection, a scissor, cotton wool to clean wounds, razor blade to cut the materials, that is a forceps, that is potassium permanganate, and soap. Potassium permanganate is to neutralize the wound or sterilize the wound, remove infections. That is the wound now. He has already calmed down the victim. The victim is seated. This is the pair of gloves for safety, not to contaminate blood or poison. He's tying the piece of cloth or a piece of, this is the gauze, trying to tie the area above the wound. What is the aim of tying? We say that to prevent venom not to go into the blood system or not to enter the heart quickly. He's trying to remove the fangs. Some snakes, when they bite, they can leave fangs. That is the cotton wool and the water. That is soap. Washing the wound to remove venom around, and also dry the wound with cotton wool. You can see the leg is put below the heart so that it will restrict blood going into the heart quickly. That is potassium permanganate. It also has a neutralization action to the wound, and also it tries to sterilize the germs, or in case there is any infection, bacteria or whatever, they are now sterilized by using that chemical, potassium permanganate. In our case, we have seen that you can use spirit, you can use gelatin violet or iodine. Thank you for watching. Okay, students, up to now, I hope you are able now to explain the meaning of the term first aid and its importance. First aid kit, the components of first aid kit and their uses, and I hope also you are able to render first aid to various accident victims, including the victim of snake bite, insect bite, and bleeding. I leave with you a homework which will try to summarize what we have learned today or what we have revised today. The first question describes the procedures of rendering first aid to the victim who has been bitten by a bee. Explain why first aider should apply pressure directly to the bleeding wound. Explain why you should not use a sharp object like a pin to remove an insect sting from the body. Next period, I hope I will teach you how to render first aid to the victim of nose bleeding and poisoning. Now, I leave with you a list of reference books so that you can go for deep study to understand more about this topic. The first book here is School Certificate Biology 1 by Ujuzi, and the other book is SCSU and MOVIT. This is the Ministry of Education Zanzibar, Biology for Secondary School, Form 1 and 2. Another book is Tanzania Institute of Education, Biology Students Book 1 and 2. When you go to that page there, you will find the materials concerning what I've been teaching you. I hope to meet with you next period. Don't miss.